everyone, this is Dr. Salcedo, your conscious gynecologist. I'm so glad you're here. Today I want to talk about a very interesting study that came out earlier in June of this year that looked into the effect of adding a well-formulated ketogenic diet to women who were having a hard time getting pregnant through IVF when they had polycystic ovarian syndrome. This is really exciting because IVF is so expensive and takes a ton of resources, and never has this been looked before, looking at the addition of a ketogenic diet with women who've had PCOS struggling to get pregnant on IVF. This study that was done in Mexico is an incredible inclusion to the wealth of knowledge that we already have of helping to improve women with insulin resistance. So let's get to it. And I just wanted to remind you that if you like this video, or if you like what I'm doing here, go ahead and subscribe. Go ahead and hit the like button. Tell me what you think. Give me your comments. What's worked for you? I would love to hear it as I continue to promote more information in conscious gynecology. Because truly, the purpose of what I'm doing here is to really try to help women understand how the world around them shapes their feminine health. So let's get to it. So this is the study here that was published in Reproductive Toxicology, and I'll go ahead and add that DOI number to my show comments so that you can take a look at it for yourself and perhaps bring it over to your doctor or share with someone who might be able to benefit from this knowledge. And that's really what I love doing here, is taking the information that we have and digesting it into people who are interested in this work so that we can help them really promote the medical education of the biochemistry of the low carb diet, well-formulated ketogenic diets, but also how insulin resistance and inflammation impacts womanhood. So the first thing, the title of the study is called Adding a Ketogenic Dietary Intervention to IVF Treatment in Patients with Polycystic Ovarian Syndrome Improves Implantation and Pregnancy. Whoa, that's really incredible. And so what these study authors did in Mexico, they actually looked at the effect of a ketogenic diet on insulin resistance and body inflammation in women with PCOS and who used IVF or in vitro fertilization, advanced reproductive technologies in order to conceive. So these were 12 women who had failed one previous IVF cycle. Now, this study looked at retrospectively approximately 32 women who had the diagnosis of PCOS and had failed one IVF cycle. Now, in this group's practice, what they do is that when patients fail an IVF cycle and are known to have risk factors for insulin resistance, they recommend that they use some sort of dietary intervention or lifestyle intervention to help reduce those metabolic risk factors. So for this particular group of women, they identified 12 women who had failed one in vitro fertilization cycle. And they said, hey, these are the options. And these women chose to proceed with the ketogenic diet in order to see if that improved their outcome. And in this group of 12 women, they had a lot of really interesting information. When they decided to undergo their ketogenic diet, they were on it for various amount of time, and approximately they were the average was about 14 weeks. A big wide range of duration before they got pregnant. Now, once they conceived, they were actually recommended to go on a moderate carbohydrate diet. And the purpose is for definition purposes, the ketogenic diet in this study was described to be at less than 50 grams of carbohydrates a day. So what happened to them? Well, from women who were on, who at the baseline, these 12 women were consuming approximately 200 grams of carbohydrates a day, which is very easy to do. And so when they started the diet, they were about 200 grams a day. And then after the diet, they were consuming approximately 44 grams of carbohydrates a day. They had about 8 kilograms of weight loss, or about 18 pounds, during their study time. And every patient was a little bit different. Some were on it for 14 weeks, some were on it more or less, but approximately 14 weeks, they lost 8 kilos. They improved their metabolic factors by reducing their glucose levels, their triglyceride levels, and their fasting insulin levels. They also didn't notice, though, a difference in the oocyte quality and the amount of the number of oocytes, which are the little the eggs that are ready to be received and extracted during the IVF process. So they didn't see a difference in that. They didn't see a difference in their fertility rate, and then they didn't see a difference of the number of viable embryos. But here's where it gets very interesting. After the approximate 14 weeks of intervention of a well-formulated ketogenic diet, there was an 83% implantation rate, where previously the successful implantation rate was 0. Okay, so just 14 weeks of being on this nutritional intervention, 83% of them actually had successful implantation. Among those of the 12 women, 66.7% actually had manifestations of a clinical pregnancy. And then 66% of those women actually went on to have live birth, which is, whoa, that's just incredible. With just one nutritional intervention after a failed IVF. And here's the thing, ladies with PCOS who end up moving on to in vitro fertilization are actually have a really hard time getting pregnant because of the inflammation that PCOS brings with people who have it. And so not only is it insulin resistance, the high insulin levels that actually suppress ovulation, but then women with PCOS actually have more inflammatory factors that damage the vasculature and potentially can lead to reactive oxidative species at the lining of the uterus that make it more difficult for the endometrium to implant. So that's actually one of the things that they measured, is that when women went through this dietary intervention, their endometrium, or the lining of the uterus, was just a little bit thicker. And the authors posit that this actually could be a good sign in this particular setting, because maybe that lining of the uterus was more hospitable to receive the fertilized embryo. And so that means a lot, because if there is less inflammation in the lining of the uterus, the vasculature will be able to receive the embryo with less problems than it would a person who had PCOS without a dietary or lifestyle intervention. So the interesting thing and the most salient point of this study was that there were significant improvements, statistically significant improvements in the live birth rate of these women who underwent in vitro fertilization with ketogenic diet. And so what we know is that approximately 9 of these women actually went on to carry a successful pregnancy of the 12. That's just incredible. And so the way they did that, they went through a ketogenic diet intervention with a nutritionist. They used MyFitnessPal, an online app that helped measure all of their macronutrients. And then they worked with a nutritionist online that checked in with them daily on how to improve their symptoms, but also coach them through the dietary intervention. Then after 14 weeks approximately, they went off the diet when they started to conceive through a successful IVF cycle. And then they went on to a moderate carbohydrate diet. Now, when we look at the actual outcomes of when and how far along these women actually carried their pregnancies, most of them went to full term. There was one that was there were 2 that were preterm deliveries at 35.5 and 36.5 weeks. But all the other patients all went to full term, which is really incredible. And so I think that also just goes to show that the condition of the luteal phase endometrium, or the condition of the lining of the uterus right before implantation, is going to truly set up the entire pregnancy. So I hope that you really enjoyed this digest of information that I gave to you for teaching you about what the up and coming literature says about a lower carbohydrate diet and helping women with infertility. I'm definitely not an infertility doctor by training. I'm not a reproductive endocrinologist, but I do understand all of the metabolism that's involved in the physiology from a generalist OBGYN point of view to help women take pieces of this information to eventually help achieve successful pregnancy. So if you like this video, go ahead and subscribe to Conscious Gynecology. Go ahead and leave me your comments. Tell me what you think. And I really hope to help continue to share these videos, and I'll see you next time. Thanks so much.